And welcome into To Your Health. You know, as we age, we get concerned about our health. We think about, of course, our heart, we think about our lungs, but have you ever stopped and thought about your mouth? You may be surprised to know that the majority of the people walking around the face of the earth today that have coronary diseases or heart diseases didn't start with the ticker, it started with the whacker, your mouth. So, you know, we wanted to learn why this happens, and I brought with me today my good buddy, Dr. Chet Swartzentruber.
Perfect.
Perfect. The more we do this, the better it's going to get. We need to get down here regularly just to test me. And Dr. Chet, you started off as an engineer.
I did.
And now, obviously, you're a dentist.
I am.
And what made that transition?
It's a long story. And
okay.
I like to talk about it whenever patients come see me, but I have this joke, and I say I used to build big bridges, now I build little ones. So I think it's kind of funny.
It is a good one, absolutely. And as I said on the opening here, people don't realize the fact that this inside your mouth, your gums, your teeth, can tell you a lot about things going on in your whole body. It's kind of like the window to your body, is it not?
That's right. And we can tell a lot about your health from what's going on in your mouth. I like to tell folks, you know, if you brush or floss and maybe your gums bleed a little bit, you know, think of that as a two-way swinging door. What's in your mouth can get into your bloodstream. You know, what's in your bloodstream can get into your mouth. What's in your mouth can get into your bloodstream. And a lot of studies have been done that show oral bacteria germs in the mouth actually end up in the heart.
Which is tough. Yeah. And we've got some visuals here to talk about what happens. And of course, it's called gum disease, and it is a disease.
It is a disease.
Yes.
We call it gum disease, and it's a sneaky disease, Jack. And what I mean is it's very slow progressing. If you just looked in the mirror one morning and looked in the mirror 6 months later, or go to your dentist 6 months later, you might not see that much of a change. But over 6 years or longer, it starts to show signs.
And that's if you don't address it from the beginning.
That's right.
This disease is preventable.
It is. Another reason that it's sneaky and a lot of times goes undetected is because it doesn't cause a pain. Think of it like high blood pressure. It's known as the silent killer. Yet I would be hard-pressed to find a doctor who doesn't treat high blood pressure routinely, because we know that if the heart is working harder than it should for many, many years, it's going to wear out faster.
So to maintain the healthy mouth, first of all, we've always heard, how many times a day should your brush internally? Should it, the best possible thing would be after every meal, is that not right?
That's true.
If you can.
That's true. Twice a day, we say.
Okay. And that would be normally in the morning and at night. Of course, in the morning, of course, you do it at night. The only thing that you're really doing in the morning is freshening it up, right?
Right.
Because you should have done the proper thing. And when we talk about brush, we don't mean just go zip and you're done, but actually brush the teeth, brush the gums, because we hear about this old guy called plaque.
That's right. That's right. We say brush twice a day for 2 minutes per time, and we like to say you brush in the morning to keep your friends, you brush at night to keep your teeth.
Okay.
And throw in there flossing and making sure all the different, and if you look at the picture, there's lots of different surfaces here, and some of these people are exhibiting gum loss already because they've had the disease for a long time. And so we try to catch this before it gets advanced and prevent it.
So obviously, everybody understands floss is that looks like a big piece of thread that you pull out and you just get in between the teeth. But now there's actually a little, they look like bottle brushes that you can actually do that. And not only that can kind of clear things that are in there, like food particles that are left over, but also does that help to massage the gum too? Should you be massaging your gums?
Think of it like this.
Okay.
The germs that cause the disease like to be left alone. Just leave them alone. If you get in there and jiggle them around and mess with them, they're going to be agitated. They're going to find another home to live in.
Okay.
Okay. You're going to have germs in your mouth. It's not a sterile environment because we put stuff in our mouth every day. We eat food.
Yeah.
We drink out of this glass. We hug and kiss our family. So we share germs, but that is why it's so important to just keep at it. It's a cleaning, it's a maintenance.
And of course, when you say they're going to find another place to go, if you do it and then swish and put,
That's
that's
right.
where they're
That's right.
going.
That's right.
That's you want them down the sink.
That's right.
You don't want them running around. You don't want them to say, okay, I didn't like it. I'm going to go up into your ear.
That's right. Yeah.
I'm going to give you an earache starting right now. So basically then, obviously, be concerned about the gums as you're brushing your teeth.
Right.
It's a very important thing to do. Making a visit at least once a year, but normally if you've been having a history of some problems, probably twice a year wouldn't hurt.
Twice a year is ideal.
Because you can keep your teeth until the day you die.
That's right, you can. We want to take care of the gums and the foundation that are holding the teeth in place. This bottom picture here actually shows some gum recession around this bridge, and it shows a gray line. You know, that has some cosmetic flaw that we can fix, but also we're noticing the gum recession, and so we want to stop that before it continues.
Okay. Well, thank you very much. And obviously a good diet doesn't hurt.
That's right.
Watch the things you're eating because they can have effect on you also.
They can.
From here all the way through your body.
That's right.
That's right. And just remember this, if you're having any kinds of signs that you may be having some problems, get to your dentist as quickly as you possibly can, because if you can catch it on the onset, you can save yourself a lot of time, a lot of trouble, and a lot of money. And we'll be right back right after this.